Thank you everyone for joining us for another Learning Lunch hosted by EMRapproved and ForMedTraining.com. My name is Brian Johnson. I'm the Senior Director of Online Education with ForMed Training, and I'll be your moderator today. Today's Learning Lunch will cover what's new in EHR testing and certification. We have two representatives with us today from the Certification Commission for Health Information Technology, better known as CCHIT. Our presenters are uniquely qualified to address today's question, and we are honored to have this opportunity to share their expertise with you. In our efforts to continue providing the medical and vendor communities with the most current and accurate information regarding HIT, EMRapproved has recently created an affiliation with CCHIT, which promotes access to its online tools for testing and certification preparation and its certified product listings. Allow me to introduce Elisa Ray, Executive Director and CEO of CCHIT. We also have with us Patricia Becker, Certification Director of CCHIT. If you have questions during this session, please enter them into the chat area during the presentation. In the second half of our presentation, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, as we are often asked this question during the session, please note that all registered attendees of today's session will receive an email with links to both the recorded and PDF versions of this event. Today's topics will include an introduction to changes in ONC's HIT certification program, 5 new challenges with the ONC 2014 edition, the base EHR concept for providers, and getting prepared for the ONC 2014 edition. Before we address our central subject, I wonder whether you could tell us a little bit about CCHIT. Most of our attendees know or think they know CCHIT, but could you give us some brief background?
You ready to start, Brian? It's Elisa here.
Yeah, go ahead, please.
Sure. So thanks for the introduction, and it's really nice for us to be here and have a chance to speak with this audience. I understand the group is comprised of a good mix of providers and vendors, so we will endeavor to cover the topic in terms of concerns for both of you, how certification may relate to that. In terms of a little history on CCHIT, Brian, if you move to slide 3, we've got a little bit of a timeline that I could walk through that I'm sure many folks on the call have actually heard of us, but this timeline's a good graphical representation. We're a fairly young organization founded in 2005. It's a nonprofit with a public mission to accelerate the adoption of health IT. If you recall, back at that time, ONC was just getting started too, with David Brailer named as the first national coordinator. And he created the first federal strategic plan for health IT. And certification was an important part of that. The idea was that if providers had better information and also a third-party trusted source to examine products, it would drive or accelerate adoption of products with agreed-upon standards that were commercially available into the market. We received a 3-year contract to actually develop ways to conduct certification. We developed original certification criteria and efficient, credible means of actually inspecting the EHRs. And we did that for ambulatory EHRs, for inpatient ones. We branched into a number of special care settings, specialty care EHRs, such as child health, cardiology, dermatology, etc., and also other domains such as long-term post-acute care and emergency departments. CCHIT quickly adapted to participate in the revised program when high-tech and the ARA incentives were available. So all of a sudden we've got nearly $30 billion being available to accelerate adoption. We quickly became one of the ATCBs under the temporary certification program for ONC, provided some leadership there. We also expanded to offering our certification into, we call the EACH program, which is helping hospitals or providers with self-developed systems meet the certification requirements. We've gone on and received all the accreditations necessary from ANSI and NIST NV to participate in what now ONC calls the permanent program. So we've kicked that off. That's going to be the focus of our topic in discussion here today. We kicked that off along with ONC in January. So we've been around a little while. We've evolved and changed a bit, but our mission to accelerate adoption has stayed the same, and we continue to support that. So I think we could go on to the next slide now and begin to get more into the meat of the discussion. I think this is where Pat Becker, my colleague Pat Becker, would pick up.
Yeah, so Pat, maybe you can tell us a little bit more about how ONC's 2014 edition criteria map to CMS's stages of meaningful use attestation. What are the deadlines for meeting the new rules?
Okay, I'd be happy to address that. Good afternoon, everyone. This is Pat Becker from CCHIT. In the new certification program that Elisa mentioned, the permanent program, ONC has changed how these things are referred to from a certification perspective. So there's now the certification 2011 criteria and 2014 criteria. I think this makes it easier. These map back to meaningful use stage 1, and then they will map to meaningful use stage 2. So if you're an eligible provider or a hospital organization, you have until October or September 30th, if you're a hospital, to apply for meaningful use stage 1. And if you're an eligible provider, you have until the end of the calendar year to apply for meaningful use stage 1. In order to apply for the stage 1, you need to have certified technology. You may, for stage 1 at this point, have either 2011 edition EHR certified criteria or the equivalent 2014 edition, or you may have the 2014 edition that meets the base EHR definition, and we're going to go into in a later slide what that definition is. So, you know, time is of the essence. If you haven't yet applied for meaningful use stage 1 to get the full amount of money for that stage, you need to do it within the 2013 calendar or fiscal year. For 2014, hospital eligibility for meaningful use stage 2 begins October 1st, 2013, which is the beginning of the federal government's fiscal year. For eligible providers, it begins January 1st, 2014. For stage 2, you must use certified technology that meets the 2014 certification criteria. And again, we'll go over the definition of base EHR a little later in the presentation.
So what can you tell us about how the current permanent program differs from ONC's first temporary program for EHR certification?
Sure, I'd be happy to. There's actually quite a number of differences. The major one is that there's a firewall that's been established between the testing laboratory and the authorized certification body. That means that there are two distinct groups. CCHIT has both of those groups within its organization. Testing is done separately from certification. The testing body provides a report to the certification body. They review that and determine if the vendor and or provider can then be certified. Another difference is that both of these groups, the Accredited Testing Laboratory, or ATL, has been accredited by the NIST National Voluntary Laboratory of Accreditation Programs, while the ONC Authorized Certification Body has been accredited by ANSI and then approved by ONC. So the certification team has to go through a two-step process. Once the certification group does certify technology, they pass that report on to the ONC, and then it's then posted to the ONC chapel, which is a listing of all certified products. Another difference that's in that process is that we used to send our reports to ONC on Wednesday, and then they would be uploaded to the chapel by that Friday of the same week. They're now taking some extra time to review the listings, and so there's a week delay, and they're posted about 10 days after we send them to the chapel.
So what's new in ONC's 2014 addition criteria?
Okay, this slide represents the 5 main differences. The first is price transparency. And so any vendor that is applying for certification has to list the components of their product for which they charge additional pricing. So that could be things like the implementation cost, if that's different from the actual software cost. It could be the use of consultants from their organization, or it could be interface development, those kinds of things. They don't have to list the actual price that they charge for those things, but they do have to list those kind of costs that you're likely to entail. A second new requirement is that the public, that we will publish the public test results, and that you will be able to look at those test results excuse me, and see how the vendor did in the testing process. Now, on these two things, the price transparency and the public test results disclosure, we are still waiting for ONC to provide us with guidance on how to actually perform those two activities. We are currently asking on our application for the price transparency information, and we have a mock report for the public test results, but the actual what's going to actually be included in that public test report hasn't yet been determined by ONC. So currently those two things are not available. Another concept that was new to the 2014 program is the concept of gap certification. And what that means is that some criteria can inherit the certification from the 2011 program. So as an example, medication list was criteria 302D, maintain medication list. If you were certified for that, you can inherit that certification for the 2011 A6 criteria. So there's a list of about 12 criteria that can inherit gap certification. For safety enhanced design and the quality management system, these are both attestation requirements, and so what you're required to do for the safety enhanced design, there are a list of 7 criteria in which you have to specify what safety enhanced design methodology you used in presenting those to the customers, and just attest to that. This is a fairly easy requirement at this time, and it's anticipated with the next level of criteria. This will be a more rigorous requirement. The same with the quality management system. All you have to do is attest to which quality manual system you are using in the development of your program. If you're using more than one, you have to attest to both of them. It is fair to attest that you're using no quality manual system. So, you know, again, that requirement is fairly lenient at this time, with the expectation that it'll become more rigorous in the next round of certification. Next slide, please.
Please continue.
Thank you. Interoperability testing. Previously, the testing laboratories were able to look at the interoperability testing, doing a manual review of the data files. You know, these files are pretty complex, and the manual review left a lot to be desired. In the 2014 program, automated standardized tools have been developed, and there's much more rigor to the testing. While you would think that the fact that we have tools would make that process go a lot faster, in fact, the number and sheer number of cases and test data that you're required to use.
Oh, here you go, buddy. Dollar.
These fairly lengthy requirements. However, ONC has recently allowed the pre-enter of some data related to these tools. So we haven't had an opportunity to test using this new method. It was just actually released on the 20th of last week. So we're expecting that that'll help shorten the length of time that it actually takes to do this testing. Next slide, please.
Like soggy.
Another tool that has been developed is the Cypress software tool for testing the clinical quality measures. Again, initially it was required that there be manual data entry of all the test cases. That was supposed to be done initially while the tester was overviewing that. They now allow the preloading of that data, and this tool is, in fact, all the tools are available for the vendors to actually practice with before they come to test. So really, there should be no surprises on test day. Next slide, please.
So physicians still have to have EHR technology that meets all of the criteria, even if they don't use those capabilities in their specialty practice. Is that correct?
No, that's not correct anymore. There's the concept of the base EHR. And the next slide will go through what's in there. And then there's a core menu set that each provider needs to have. And then there's some optional menu sets as well, so that if you're not using something within your practice and it's part of that optional set, that you do not need to have certified technology that meets that criteria. So this is ONC definitely listened to the provider community in the way they've developed this what the providers need in order to attest to meaningful use 2014 and actually 2011 if you haven't already attested. However, many providers are still choosing to adopt a complete EHR, which is an EHR that has all those criteria certified. So the next slide talks about what's in the base EHR. So you see its demographics, problem list, medication and medication allergy list, clinical decision support, provider order entry, the clinical quality measures, transition of care and data portability, and then the security and privacy requirements as well. So you can see this is a much reduced set from what was in the 2011 criteria, where you had to possess the technology that met all of those. Now, of course, within your organization, if you're a provider, you'll need to decide what other pieces of the certified technology you want to have and use within your organization. But this is the base requirement. These are the base requirements. Next slide, please.
So what can HIT developers and providers do to prepare themselves for the new rules?
Tells me 70 about 70 are in there. The questions are asking.
The main thing you can do is become familiar with the new rules. They're very lengthy and through them and make sure that you have an understanding of the rules. You'll need to determine whether, if you're a provider, whether you need to have a complete EHR or just a module that meets the base criteria. And you'll need to ask your vendors about their plans for certification. Unlike the 2011 program, when we opened our doors for certification, there was a flood of vendors coming through. This time around, the vendors are being taking their time, making sure their products are well prepared, and we haven't seen the floodgate that we saw in the first quarter as we did when we opened the 2011 program. There are some vendors, of course, that have certified. There are a couple of vendors that have done complete certifications, and we do have applications pending for additional vendors to get certified. But again, they're coming through a lot more slowly than they did the first time around. If you're a developer or a vendor, you need to get acquainted with all the new criteria and with the test procedures. The test procedures are much more rigorous this time around, and many of them have required test data, and you must use that data in order to go through the testing. And then you need to practice using all the new tools that are available, particularly for the interoperability and for the quality measures. The quality measures can take a couple of hours to go through, and there's also the automated measure calculation, which at this point in time is taking about 4 hours if someone's doing a complete certification. So it's really important that you understand the requirements for the safety enhanced design and the quality system as well. This is a resource of some of the testing of the rules when they were published. The meaningful use and incentives was published in September. The final rule was published in September as well. And then the test methods were first published in December, although we are continuing to get updates to the test methods. In fact, the last update we received was last Friday. Not each test method does get updated. If you certify on a test method and then that test method is updated, you do not need to come back and recertify on the updated version. However, if for some reason you need to be retested, maybe you've made some changes to your product, you will need to be tested then on that new method. So there's been updates to the interoperability tools that were published on February 15th, and just as recently as last week, we also received updated guidelines on which of those tools we can allow vendors to pre-populate the test data in order to expedite the actual testing process. Next slide, please. So where can I find the list of certified technologies? For those vendors that are certified by CCHIT, we have that listing on the CCHIT website, cchit.org/find. We'll give a list of all the products that CCHIT has certified. The official list, however, is on the Certified Health IT Product List, known within the industry as the ONC Chapel. You can see that you can get a list of the 2011 certified products, the 2014 certified products, or a combination of both of those. Next slide, please. CCHIT has developed a tool for vendors and providers to use who are interested in becoming certified. We call it the Source. And at this site, we provide a CCHIT version of all the test scripts. They follow all of the testing methods. We've just put them in an order that we think is easier for vendors and providers to work through. These are downloadable to you. They're Word documents, so if you need to write notes and you want to put them in the document, you're able to do that. So again, this site is available for both EHR developers or for healthcare providers who have self-developed products or maybe using an older product that they want to self-certify. Next slide, please. So registration at the Source is free, and it gives you access to introductory information, or you can purchase the Get Certified Toolkit. If you've been previously certified by CCHIT, you have access to the 2014 Certified Toolkit at no charge. The fee for the Get Certified Toolkit is deducted from the certification application once you submit that. And there are resources to help you manage your testing and certification. It allows you to easily provide product updates, which is a requirement, so that if you go from one version, say version 6 to version 7, you're required to notify CCHIT. We look through the changes between version 6 and 7 and determine whether or not you need to do some retesting or whether you can inherit the previous version. Next slide, please. One of the things that we think is, and we've been told actually while we were at the HIM show, was that we've created something that we call the ONC criteria browser. And what this does is allow you to check each of the criteria. It'll tell you whether it's a new criteria, a revised criteria. It'll give you the full text of what is required. There is a tab that also to look at any of the related standards associated with that criteria. We also have a place where you can directly link to the test procedure, both the ONC test procedure, and shortly it'll also link to the CCHIT version of the test procedure. And then we have a brief description of what's the differences between the criteria for 2011 and 2014. So that's the end of our formal presentation. We will want to open it up now for questions.
Yes, we have a large audience today and numerous questions, so I'll throw out the first one and let you answer it, whichever one of you think is the most appropriate to answer. So the first question is, I see that several EHRs have received certification for 2014 meaningful use criteria, specifically Epic, Greenway, and NextGen. Where can we find the publicly posted documentation required regarding UCD? Will it be with CCHIT, the individual vendor, or the ONC or CMS?
That's an excellent question. As you remember, there is a requirement in the final rule that the test report be made public. However, we have not yet received guidance from ONC on where to publish those test reports or on the exact content that will be within the test report. Now, we would feel confident once ONC does publish those guidelines that we'll be able to meet them because, you know, obviously we keep everything associated with the testing. So once those guidelines are published, we'll create the reports and make them available in the method that ONC has established. So the short answer is they're not currently available.
All right. Our next question is it base EHR enough to allow providers to attest to having AIU certified EHR technology in 2013?
I'm not sure I understand that.
I'm not sure I understand what AIU is.
Yeah.
Yeah, A/I/U. I'm not sure what they mean either.
So maybe they could clarify that and we could come back to that.
All right. What is the status of monitoring hiring of ONC's certified HIT Pro workforce for these programs?
I'll take that.
Okay.
I think the questioner is mixing a couple of different ONC efforts. Certification is the criteria are created by a couple of FACAs, the standards committee, right, and work groups there. ONC staff are actually assigned the operating role of the certification program, and then of course the compliance and testing bodies, we're one of them, do the work in the field. Something separate ONC has is a workforce training program where they're actually set up curriculum, a number of community colleges and some four-year programs too for some generating some talent or skills for implementing and helping providers adopt certified EHR technology. So I believe those programs are still happening. There are folks out there that have these qualifications. I can editorialize with my personal experience a little bit, and that comment would be that we've had such an explosion of adoption, right? Things have really, really kicked off that the biggest probably risk to the whole federal strategy is having enough qualified and probably experienced, maybe beyond just new graduates, but folks who have some real experience in implementing and getting EHRs up to speed. That is a big challenge and I'd say a risk to the program. Hopefully that helps.
Another attendee would like to know, where can you get a list of gap criteria that can be inherited from stage 1?
It's actually in the rule, but I could quickly go through what those are for you.
I believe in the slides that are going to be published, we've included a slide in that. The slides that are going to be distributed actually have a slide in there that lists the gap criteria. It's slide number 9.
Yeah, maybe perhaps you could go back.
Should I go through that? Yeah, you all will get this slide deck. It's slide number 9, and there are a number of criteria. I'll just read them off. Medication lists, med allergy lists, incorporate lab results and values. That's only, of course, for inpatient. The immunization information is a gap criteria. Authentication, access, and authorization. Emergency access, automatic log-off. Accounting of disclosures, which is optional, and computerized order entry, and advanced directives, inpatient only for that one. Again, that's slide 9 and the deck that will be distributed.
Another question we have is, can vendors get exceptions to test components if they do not supply systems to that environment?
So the way that's handled is that a vendor would apply for modular certification and only get certified for the components that they provide into the market. If you're going for certification for a particular component, however, you must complete all the test steps within that component in order to receive a certification.
So we had a follow-up to the question asked before. The question was, is a base EHR enough to allow providers to attest to having AIU? And we were a little curious what they meant by that acronym. Adoption, implementation, or upgrade is what I'm seeing here. I don't know if that, does that help the question make a little more sense to you?
If a provider has a base EHR, they're eligible to attest as long as they're also able to meet the clinical quality measures. And again, that's a menu set of measures based on the kind of practice that they have. So the answer would be yes, because the clinical quality measures are part of the base EHR.
Okay. Here's a longer question. And it's related. Under the Medicaid program, providers are only required to attest to having adopted, implemented, or upgraded certified EHR technology in their first year of attestation. Is a certified base EHR enough to allow these providers to attest to having adopted EHR in their first year?
Yeah, actually in the Medicaid program, all they have to do is be in the market for attesting for the first year. So there's actually the ability to use some of that money to actually purchase and implement the EHR. But it has to be certified technology. Remember again that BASE only applies to technology that's been certified under the 2014 edition. So if they're looking at technology that's only been certified under the 2011 criteria, they need to have the full suite of certified technology. So that's something that people really need to understand, because if you look at the list of 2014 certified technologies, at this point it's relatively small.
Here we have a question about QMS. Someone wants to know, when you're talking about QMS, are you referencing ISO 9000 for vendors? I'm not sure.
I don't have memorized all of the standards that are behind that. So if you would take that question, we'll answer it in the written responses later. I believe it is ISO 9000, but I don't want to 100% say that it is.
All right, here we have another question about specialization. We have a specialty EHR, and some of the certification criteria are not applicable to our providers. Based on the base EHR definition, I understand that we don't have to build and certify for criteria that our customers will not use. However, if we choose not to certify for those objectives, immunizations is one of those, does that mean we are certifying as a complete EHR or as an EHR module? Please clarify the base EHR definition as it relates to EHR certification, particularly for a specialty EHR.
Okay, so a base EHR would be a modular certification. A complete EHR means that you certify to all the criteria within either 2011 or 2014. So if you came forward with a product and you only brought forward the criteria that Elisa went through earlier, or no, those were the gap criteria, sorry. If you only brought forward the components that are part of the base EHR, you would receive a modular certification.
All right, I'm looking through the questions. There's a lot of questions. I think there's a lot of confusion about what we were just discussing in terms of the requirements for base EHR versus, certifying just a module. So there's another question about a provider needing to purchase more than the base to meet the immunization measure, if that question makes sense.
I'm going to look at. Well, the immunization measure is not part of the base EHR. So if they feel that they need the immunization measure for some other reason, then they would need to purchase that technology that's been certified.
Here's a question on another. Oh, I'm sorry. Go ahead.
Perhaps you would want to go back to slide 10, which lists the criteria that are required in the base EHR.
This slide here?
Yes. So again, the criteria on the right-hand side of this slide are the criteria that is in the definition of the base EHR.
Here's another question. Please cover what CCHIT will be required to do to ensure the vendor reports are accurate for core, menu, and CQMS reports.
So in the CQMS, we actually list all of the clinical quality measures that the vendor has passed as part of their testing. And what would be the other two pieces of that question, please?
Oh, I'm sorry, I skipped ahead.
Okay.
It's please cover what CCHIT will be required to do to ensure the vendor reports are accurate for core, menu, and CQMS reports.
Well, the report will list all of the criteria that that the vendor has passed. So you'll be able to look at that and determine whether or not they have passed all the core criteria or the measure or the optional criteria. So the report will be a thorough list of everything the vendor has passed during their inspection and testing and then have been certified for. We also, so that will be part of the public report when that becomes available. We also give each vendor a certificate of certification, which also lists the things to which the safety enhanced design have been applied for, and all the criteria which they passed during the testing process.
We have some questions about encryption. One is, can you expand on the criteria for encryption at rest? Many open questions on this, the questioner says.
Okay, I'm a bit familiar with that testing method, but I won't say that it I have it in detail. So what I'll do is we will respond to that in the written questions, and I'll have one of our testing team look at the questions and get back to you.
All right, here's a detailed question. If your system generates an Excel output, then passes it to Microsoft Report Manager, and then that's downloaded to an external device, who is responsible for encryption? The HIT vendor or the service, the MS? I'm not sure if that completely makes sense.
Yeah, it does. There are requirements within the criteria that the vendors responsible for encrypting data that is put on a portable device. And there's some specific language in there that you need if you're a vendor to become familiar with in terms of what is the requirement to pass that certification criteria. So that, again, is something that you need to look into very thoroughly in order to pass that.
It looks like we've gone through the major categories of questions. There's some that are repeating the same questions. I wonder if there's other areas we haven't touched on that you might want to expound on now.
I would just say that, you know, based on these questions that have come forward today, again, this is where we use the source to help vendors get through answering questions like this. So if the certification team, which is the primary group that responds back to the forums on the source, are not able to answer the questions, we will send those on to the testing team who have experts in interoperability, in security, and in the clinical measures as well as the clinical quality measures. So, you know, we have in-depth expertise in all of those areas that are available to you to help you answer your detailed questions.
Well, thank you, Elisa and Patricia, for joining us for today's Learning Lunch. Is there anything you'd like to add?
Elisa?
Well, I think we all have a much better understanding of the testing and certification landscape. I would also like to thank all of our attendees today. All registered attendees will receive an email with links to both recorded and PDF versions of this session. Be sure to join us at EMRapproved for our next Learning Lunch session. We'll be increasing our dates and topics in the coming weeks. Keep an eye on your email box and our homepage for upcoming topics. And thank you again for joining us today.
The organizer has ended the session, and this call will be disconnected. Goodbye.